So I want to welcome you to our PFCC Connect COVID-19 virtual discussion today. The topic is connecting to community as healthcare services begin to resume. So in the midst of COVID-19, all states are reopening in some fashion. Hospitals are preparing or have started resuming surgeries and other outpatient services. Primary care is trying to invite people back in to do their needed ongoing preventative care, vaccinations, and those kinds of things. And so the issue really is, are our communities ready, and how might we partner with them in ways that are helpful? So I'm joined today by Marie Abraham, our Vice President of Programming and Publications. And I really appreciate her joining us as the chat monitor today. Things are very busy for IPFCC because we are launching our first foray into virtual international conferences, and she's leading that effort. But she also is a great chat monitor, so thanks, Marie, for joining us. I'm Mary Minetti, the Senior Policy and Program Specialist, and I kind of facilitate the PFCC Connect community, which is over 2,000 strong and growing. And we are here today because of the great technical support and assistance that we received from Natasha Reed, our Registration and Database Manager. You'll notice that there's a quick poll up about what are your, what roles do you have? And so I would love it if people would complete the poll, and Natasha and or Marie, if you think we've got about 37 people on the line, if you can take a look and see what kind of response we're getting, it would be great for us to know who's involved and in the room.
We have almost 70%.
Oh, that's pretty good. Well, yeah. So why don't we go ahead and take a look and see who's here in terms of roles. Are you going to be able to display the poll for us, or just tell us about it verbally?
I can do that.
Oh, yay! Yay! Great. Oh, I love that so many patient and family. Where did it go? The results disappeared.
Oh, yep. Go ahead. I'll back you up, Mary.
Can you bring it back, or are you just going to tell us? So, oh, thanks. So over half are patient and family advisors. I love that you guys are so engaged and involved. Especially now, we need all the advice and lived experience and perspective from our communities that we can get. And then, of course, coordinators are important because they help facilitate the integration of patient and family voices into the organization. And we've got a variety of other individuals as well. It's always great when community programs are represented, and so that's wonderful. I really appreciate knowing that. Given that we're talking about COVID-19, having risk and safety personnel involved, even though it's a small number, is great. And our patient experience and patient relations personnel are often allies with coordinators of PFCC. And without clinical and administrative leaders, setting the culture for PFCC is often doesn't happen. So we've got a really diverse group, but it's led by, in sheer numbers, by patient and family advisors. So I'm really going to be excited to hear what kinds of feedback people are going to be giving us as we talk about this whole idea of connecting to community and for resuming operations. Natasha, if we can go to the next slide, that would be great. For those of you who are on the call for the first time, I just want to reinforce how important this conversation is, and how the whole purpose is for us to learn from each other. And we want to share all the resources and the knowledge that you bring to the table. So that is what we really do in these conversations, is we make time for sharing. And if you'd like to chat in your name, your organization, and your country, it's always nice to see how many Canadians we have. Sometimes we have people joining from across the pond, as people like to call it, and then in the United States as well. So you're certainly welcome to chat that in. If we want to go to the next poll, so we know there's a lot of patient and family advisors. but it would be great for us to be able to see what kinds of settings people are working in. And so we've listed the different settings that people might be working and participating in, whether as patient and family advisors or as caregivers or leaders in healthcare organizations or in community organizations. So we'll take just a minute to give people an opportunity to chat in, or not chat in, but actually complete the poll, and we'll see who we, what kinds of settings are going to bring some lived experience to us. And as I'm looking at the chat, we've got people from all over, from the East Coast to the West Coast. And I love that we've also got people who represent health plans as well as healthcare providers or organizations. So how are we doing, Marie, on the poll, Natasha? We have a fair response.
I do not see the results, so I'll rely on Natasha for this poll.
Oh,
Natasha also does not see the results.
oh goodness.
Let me see if when I end it and share it, if you can see it.
Okay. Oh, I see you sharing the poll results. I don't know if you can see them, Natasha, but we have the majority, 77% from hospital and medical centers, 7% from primary care, 13% from ambulatory, 10% from communities, and 7% from other, which probably is our health plan folks, potentially, and others. So there certainly has been a lot of activity in the hospital arena, but I'm hoping we can also be talking about what's happening out in the community as well. So if you want to go to the next slide. So I want to kind of just launch this conversation a little, and as I was thinking about this particular topic and some of the conversations that are happening on PFCC Connect, and also the conversations that we're having with colleagues, there is a shift happening. We have hopefully flattened the curve, and it will stay flat, although we are seeing spikes in certain areas of the country. But we are beginning to resume operations. And I wouldn't say we have a new normal. I wouldn't even say what normal is. I think there's a lot of variation across the country. I see efforts in long-term care to try to continue to maintain safety, but also create opportunities for families to join loved ones in a safe space. There's concern about missed health care for people with chronic conditions or for children who are missing vaccinations. But there is a big push to open up services, and there are a number of reasons. One, obviously, is that we want to make sure that we can keep the entire population healthy and address issues that have been delayed, care that's been delayed as a result of us addressing the COVID pandemic. And we're also aware that hospitals, as well as primary care and other settings, because they basically constricted what kinds of services that they were providing, really has taken a hit economically. And there have been people who've been furloughed, and hopefully with the resuming of services, we're going to be able to bring people back so that they can provide that care and continue to improve services and the health of their communities. It's a complicated time because with the economic downturn for many people who have had to apply for unemployment across many sectors, the whole issues of social determinants of health has been impacted, and there are more people than ever who rely on the safety nets, the social safety nets, to cover the gaps because income isn't coming in, and that certainly can affect delayed care, and it can affect health. So it's a complicated time. and we want to be purposeful and mindful of how we move back to providing care in respectful ways, and also how we partner with patients and families as we move into that transition. So we're going to have one more poll. We can shift to the next slide, and then pull up the poll if we can. And that, based on what I've been hearing, and also a strong interest in knowing what your current experience is, we'd love to have you check any of these situations that apply. So we know that in COVID times, at the very beginning, family presence was really constricted tremendously, the ability of families to be with people. There were exceptions for pediatrics and some end-of-life things, but for many others, there was no family presence in the hospital. We're interested in knowing, has family presence been expanded? Are general visitors now welcomed with some screening protocols in your hospital settings? What kind of demand? Do you have a strong demand for elective care, since there's been kind of a hiatus on elective care? How are social determinants preventing people from accessing care? Is that an issue in your community? Have your PFACs resumed activities, at least virtually? Has telehealth it became a real important way to provide care? What's happening with that? And what are you getting in terms of the sense of the pulse of the general public on resuming healthcare services? So if you can check the polls so that we can just see what kinds of experiences people are having, and then we're going to share what we're learning and experiencing during this time together. It's always nice to kind of take a pulse of the people who are in the room, the virtual room. Okay, so I think everyone has can see this poll. Looks like about 22% still have some fairly reduced care options and strict COVID-19 policies. 65% have experienced the pulse of the public is that they're very fearful of resuming healthcare services. Over half have resumed PFAC activities, and telehealth and virtual visits are continuing to be the main source of care outside of the hospital. And there hasn't been a lot of shift, 13%, in terms of family presence increasing and visitation of general visitors being welcomed. And only about a quarter have had a strong demand for elective care. So, so let's start our conversation now that we have a sense of what people are experiencing. And if we can go to the next slide, please. So let's talk about these general categories and have people share their experiences. And we will, what I'd like to do is I'd like to start with number 2, which is, how have you addressed the issues for people of color who are disproportionately impacted by COVID as it relates to resuming services and inviting them back into different care options? It sounds like things are moving slowly in terms of that, but setting the stage and building the foundation and building trust is really important. So, and since we have so many PFAC members, PFAs on the call, it would be great if you can talk a little bit about, if as a patient and family advisory member, if you've partnered with your community organizations in your community on addressing issues related to equity and trust and access to care. So I'm just going to open it up and encourage people to share. We have a lot of people on mute. We've got 40 people on the line. And we've lost a lot of people on the video.
Hi, I can share. My name is Dion Sinclair. I'm a director at South Lake Regional in Ontario, Canada. So we have continually been in contact with our PFAC members. They get updates, and we have a virtual town hall. In the height of COVID, the town hall was at noon daily, and they were involved and they were updated. We've also had several of our COVID patients who have recovered and went home. They were featured on national news, CTV News, and W5, one of our television program that actually went with the patients and interviewed them, and they were able to share their experience. We've had a lot of support from the community, and I believe that the families are coming back to emerge. They are coming back to get care, and we've also just started ramping up for our surgeries. So patients needing elective surgeries are able to come in. There's a very fulsome ramp-up program going on, and we've received the go-ahead to start with surgeries again. And how have you addressed issues for patients? Color disproportion. Again, here in Canada, we have our great healthcare system. So anyone walks in the door, you have a whole life card, you get cared for. As the director of the largest program in the hospital, there hasn't been any issues with patients of color coming in, because I'll be the one greeting them on the floor, and I also have managers and frontline staff that are very diverse, and South Lake is exceptional that way. Our leadership team is quite diverse, so I don't see there are any issues there at all. And I meet with our medicine PFAC regularly, and they have been updated and up to date with what's going on in the hospital.
Great. Dion, the whole issue of fear and individuals out in the community being concerned about resuming care in a safe way. How have you've had town halls and you've engaged your community? How have you listened to those fears and addressed them in ways that make individuals feel safe to resume care?
How have we addressed their concerns? There was notices actually went out in the newspaper, and I know a notice board that it is safe to come back to emerge, because we did have our emerge volumes drop, and we let the public know that we had personal protective equipment. These are all the safety measures that are being used. The staff, because it's a community, it's a large hospital, but it's still a community hospital. Most people who work at the hospital have their family and friends in the community, and they were being told by staff that yes, it is safe to come in, it is safe to come back. We also have an assessment center on site. So anyone from the community who needs to come in to get assessed for their COVID status, they're able to drive through to the assessment center, which is on the side of the hospital. I saw one question, somebody was asking about a medicine PFAC. So it's a patient and family advisory group that's part of the medicine program. So if you're a patient and family member that's gone through the medicine program, we have lots of brochures asking people to volunteer to be on the PFAC. Surgery has their own, cardiac has a PFAC, but that's medicine PFAC are medicine patient and family advisors. Claudia here from Ottawa Hospital. Okay, we definitely can connect, Claudia. So it is our patient and family, they're very active. We have them sitting in on interviews for hiring staff members, from nurse practitioners, social workers. That's one thing they've been very active in, even nurse educators. And they also sit at the committee level to give feedback before any decisions are made. They are right there. It's nothing about them without them, really. And they're very active. And also we do have a lot of family members of our staff members who become patients, or any retired nurse who becomes a patient. They're active members of our patient and family advisories.
Great. Thank you, Dion. You've been very thorough in sharing with us what you have been doing. I'm interested in knowing if other individuals, other organizations have spent time learning from COVID patients, what their experience is and how we might improve care ongoing for that particular population. Have others systematically worked to understand from both families and also the patients who have had COVID?
This is Erica Steve from Wellstar North Fulton in Roswell, Georgia.
Hi, Erica.
Hi. One of the big opportunities for me, I'm also over complaints and grievances, so I get to see this from a proactive standpoint and then, the reactive side. What we've identified with a lot of our COVID patients, the fact that we currently don't have family members present when it comes to care transition, making sure that patients understand their plan of care. They know what they're responsible for when they get home. There has been, it's an enormous gap. And we were truly dependent upon family members that were there at the bedside to assist with that. So we realized that it's a huge opportunity where either patients aren't able to articulate this information to their loved ones once they, get out to their vehicles. We're realizing that our discharged folders, they're really not as meaningful as we thought they were. So we're revamping that process with our patient advisors, going back to the drawing board in regards to looking at our discharge folders. How meaningful is the information in it? The AVSs, are we really highlighting those 2 or 3 things that patients need to work through? And we've also incorporated Samsung tablets on the floor where we're contacting the loved ones, even though they're out in the parking deck or they may be en route to the hospital. How are we making sure that we're educating them to medications and things of that nature? So we've incorporated technology, and that's something that I'm really excited about. We're going to be utilizing that even the more with the COVID, everything, going down a little bit. So that was one thing that we've worked on. Also with the tablets for our patients not having their loved ones here, we've incorporated them in our IDR rounds. The technology that we're now using, the patients are able to have up to 14 family members in the virtual waiting room. So when the physician gets to that particular, when the nurse gets to that patient's room, there's an option to dial it to, the family members who are already waiting in the virtual waiting room. They can pop up on the screen and they can hear the conversations with all of the various disciplines. So that's been a win for us as well, because sometimes before all this happened, family members couldn't either take off from work, or maybe your children lived upstate. So we're going to definitely keep that in place as well, so that we can have that family member present, not just because we don't have visitation, but because of even the traffic here in the Atlanta area. So there's a lot of learnings that have been taking place, and we're excited about the technology that we're using, and we definitely saw a huge gap when it came to care transition. I hope that answers your question.
It does, Eric, and it sounds like you've really been proactive utilizing virtual technology to try to fill that gap in as much as is possible.
Yes, we're trying.
Has your organization done any follow-up using technology once someone gets home, knowing that there are a lot of gaps in that understanding, to kind of, do some teach back and just check in with people so that they don't end up being re-hospitalized?
Yeah, so that's something that we're currently working on with our transition center. They call 100% of our inpatients, and we're doing follow-up in that regards. There's still a lot of opportunities. I'm going to be completely transparent with you. There's still some opportunities there in regards to really understanding the medications. People learn differently. I live in what you would consider like a I don't live here. I can't afford to live here. But the hospital that I work at, you have a lot of, doctors, lawyers, just a lot of retirees that would really, what's the right word I'm looking for? Highly educated individuals, and sometimes we take it for granted just because somebody's highly educated. That doesn't necessarily mean that they are highly educated when it comes to healthcare literacy, and that they people learn differently. Some people are visual learners. Some people like the audio. So there's a lot of opportunities that we've identified. Just because somebody presents well, we're really wanting to work on our unit that we have more dementia patients. They go in and out. So when you're presenting to them, they may seem like they're all there, all their facets are there. But once they're discharged, they aren't able to articulate those same things to their loved ones or to their family members.
Great. And you mentioned very briefly, but I'm wondering if you can just enlarge upon it a little bit, that you've identified these gaps and you're working with your PFAC to try to address them. Can you describe some examples of how you've done that, or some ideas that they've come up with that have been helpful to you as you look to improve?
Yeah, so like one of the examples is on our ICU unit. They typically don't discharge patients, but with everything that's been going on, we've been shifting. We've having more of like DKA patients, or patients who newly on insulin, or cardiac patients are starting to go up to that unit. So our PFAC has helped to develop discharge packets specifically to those patient populations, and trying to customize them a little bit more to have more community resources for that patient population. On our med-tele unit, we call that the hodgepodge unit, where you can have up to 6 disciplines on that particular unit. Literally the other day, they were having a conversation, and the terminology cabbage kept getting thrown out there. Cabbage, this patient's cabbage this, cabbage that. So just really asking the patient advisors to act as if this is a new diagnosis for them. And it's all done virtually right now. I scheduled team meetings. I shared with them what a packet looks like. I wish I had one with me. Share with them what a packet looks like. And we literally went line by line. We found out some of these packets are up to 26 pages. But we went line, this is what the photo looks like, but we looked through all of the information, and whenever a word popped out at them that they didn't understand or they needed clarity on, we're just highlighting the words and taking it back to the clinical team and I didn't know them either, which is a good thing. So, because I'm not clinical, so I was like, yeah, I don't know if that question or that word means either. So highlighting a lot of information and trying to get rid of a lot of the white noise. And then also making sure that we are utilizing our patient discharge folders better. We have an option for like, what are the 3 most important things? We're finding out that we're not even utilizing the tool. We have the tool, but it's not truly operationalized here on the units.
Great. Well, thanks for that very specific example. Sometimes being able to see specifics can really make a difference. So Kate Mayer, I noticed that you made a comment in the chat, and I wondered if you wanted to share a little bit more about your roundtable discussion that you're doing, which I think may be a way that you're trying to address the issues for people of color impacted by COVID and other health disparities.
Yes, our hospital was having a weekly town hall for COVID-19, and then the demonstrations and George Floyd's lynching led to huge outrage. And we did have the medical students, I think, demonstrated white coats for racial justice. And then there's been a lot of awareness raised among leadership that there is these health inequities. It's just become more visible to people. And so they had a town hall, and then they had another, and we have another one Thursday. We're starting to look at how can we make people feel more comfortable coming into the hospital and ensure that they have the healthcare needs met, but also feel welcome, I guess, is one of the issues.
And are you utilizing your advisory council or community groups that represent those populations in order to integrate their perspective into how you're addressing this? I think it's great. I think it's great that you're addressing it and having conversations among staff about it. and looking for ways to welcome. And I'm just wondering how you've made the connection with the people with lived experience in your community resources.
Well, we're definitely using our Family Advisory Council's feedback. This is all kind of new. They're trying to do employee group discussions too, and every manager is looking at ways to integrate this. We have a Latino family resource program that's part of our family-centered care group, and we have a great manager for that who rounds with the Latino families and helps advocate for their needs and also that they get health equity. It's very easy to not include people who aren't speaking the language that you're presenting in, and it's not necessarily intentional, but a lot gets missed. And so we're trying to look at that.
Mm-hmm. Yeah. And that's important to be aware of that and come up with some other ways to deal with that. Roger, I see that Cook from Kaiser Permanente in Roseville, I see that you're on the line, and I'm wondering, I'm guessing that, are you on a PFAC for a hospital or in a community PFAC? I'm wondering what your experience has been as a PFAC member in terms of talking about resuming services and inviting people back into the organization.
Get on. Now I'm on. I just unmuted myself.
Yes.
I work within the hospital setting, but right now our Patient Family Advisory Council is still under a suspension because of safety concerns, and but I am recently was put on the Safety Council for Kaiser Hospital, and we cover all safety issues going on. But that was just last month. I attended one meeting, and so I'm not quite the expert I would like to be on imparting information.
Mm-hmm.
I know the hospital is doing its best to reintroduce people to the hospital, but a lot of people are very, very fearful about coming into the hospital setting because it's you don't know what's there, and it's hard to communicate to patients and their families about what they should be expecting when they come to the hospital or one of the clinics, and that in itself poses a barrier because people are fearful. Our hospital itself is a very large facility, multi-story, lots of elevators, which people are a little bit worried about getting in with people they don't know. And there is the waiting rooms they've been working on that. They're getting that settled out where people aren't sitting in large groups and people are being scheduled to come in and have very short wait periods. But I would say we are still in the beginning stages of reopening the hospital. And I would have a better handle on that, but right now, no volunteers are in any unit of the hospital are there. They're just talking now about bringing back volunteers in the emergency room, and but that hasn't really started yet. And so I'm kind of here primarily to learn, to see what other people are doing, and I will carry messages back to the Safety Council, and I will to the Patient Family Advisory Council once they decide to reinitiate that one. But it's been a while.
So the coordinator for your advisory council hasn't created some virtual ways for you guys to stay connected during this time, it sounds like.
No, the Safety Council has, and they meet approximately monthly, and actually our next meeting is a week from today, and that will be my second meeting. So it's going to take a while for me to catch up.
Yeah, yeah. And I know that there are a lot of patient and family advisors that very much want to be actively involved and contributing, and it sounds like many are, just not in your arena. So is there another patient and family advisor on the line that can talk a little bit about how they've been involved, so that perhaps you can suggest some ways that Roger might talk with his organization about what others are doing? Often a little peer pressure and some examples of what's possible can really encourage organizations to reestablish that connection with their advisors.
Hi, this is Kristen Weisberger.
Kristen, go ahead.
Hi, this is Kristen Weisberger from Swedish Health Systems, and I facilitate our work with patient family advisory councils, and we have been holding now for 2 months virtual meetings via Teams, which is kind of like Zoom, but it's a Microsoft platform. And that has worked really well. And one of the topics that we covered was the communication to the community about what type of safe practices that the hospital is following, what they could expect when they're coming in, especially for ambulatory visits or preparing for a surgery, and then getting their opinion on what sorts of things would help as an outreach, that they would expect. For example, would it be an email? Would it be a short video clip? And then for those of our advisors that had virtual visits, some of their feedback, we collected feedback to share with our providers about what their experience was and how we could, we did an exercise called Even Better If, how could we make it even better? And so that was one valuable way. The other thing is using the virtual meeting platform, we can still share documents or slides, and it really, I think it's expanded our minds. We all have a bias in some cases for in-person, but it showed us that we can still keep our patients involved and yet feel good about safety as we navigate into these next phases. Washington State's among the states with a more careful approach, and being in King County, we are still not gathering in large groups, so we couldn't have an in-person meeting. And the feedback from our patient advisors was that they really appreciated that chance, and it was a good way to give them an update on what are some of the things that the campus-based hospitals are doing, and then what is the approach towards reintroducing ambulatory care.
Great, thanks for sharing that. So there are lots of opportunities and ways to involve them, and I'm very curious, your exercise called Even Better, is it a worksheet that people fill out so that they can think ahead of time, or is it just a series of open-ended questions that you facilitate?
It tends to work best if we have, it's really nice when you can do this exercise when you're walking through a whole process, but given that we're not able to do that at this time, what I did is have some 3 basic targeted questions ahead of time for the patient advisors to think about their experience with virtual care. And then we had a discussion about what their experience was and then what would make it even better. One of the things that I like about this exercise is it helps frame the conversation in a constructive way, but yet still allows someone to share, what their experience was. So it's, what's my experience, and then a constructive, what might be a suggestion to help support that. But I would say that even I was surprised at how good the experience was among those that had virtual visits. So.
Great. That's wonderful. If you'd be willing to share what those 3 questions are and the context that you provide as an example, that might be something we could share on the PFCC Connect community. I think we are having a lot of virtual care now, and it's really stretching a lot of organizations, but the sooner the better that we can begin to capture some information from those who've experienced it so that we can make it even better. So I appreciate you sharing that example.
Yeah, happy to share that. Thank you.
Great, great. So let's go to the next set of slides. The questions are a little bit different, and these are things that came up when people registered. These were questions that were raised, and so I want to just take a minute to take a look at them and just open it up for people to share what their experience has been. And it really fell into a couple categories. One had to do with patient and family partnership experiences. And we've talked a little bit about whether PFACs are active and how they're contributing, and that's been great. But other people were interested in knowing if people have been purposeful and mindful about and effective in including the voices of those affected by COVID, and then you know, how they're supporting or families in this time. And then there were some specific areas of concern that I think have to do with the environment we're in right now. One was, our hospitals, communities preparing for potential surge after all the demonstrations and protests, which does put people at risk because they're in large groups, and imaging and screening and how that's been impacted. So if people have things that they want to share about that, or you're thinking about it, we'll take just a minute for you to be able to read some of those questions. And I want to just give Rebecca Macon an opportunity, since you, Rebecca, put something in the chat, and I hope that you can join us verbally and share a little bit about what's happening in your community and how you're working on eliminating disparities in healthcare. Rebecca, can you?
Hi, can everybody hear me?
I can, yeah.
Awesome. Well, I apologize. I think it's my first time on unmute during one of the larger meetings, so I apologize. I'm still getting used to kind of the technologies and everything. So I'm just a PFAC member. I'm a patient parent as well as a patient of Johns Hopkins, and I was, blessed to be a part of that organization. I've really enjoyed it. And one thing that I think would be a really great step is to get some input, kind of candid input from community members, kind of, I guess you'd say, on a whim. So somebody's leaving the hospital, maybe have, instead of like a paper survey or a survey that you get via email, have somebody responsible for either doing something via telemedicine or going in to talk to the patient about what's going to facilitate follow-up for that patient, what's going to facilitate follow-up for maybe a family member. Are there any barriers? Is it, I know that some of the social supports that we've had, I've heard that transportation will allow generally, just a caregiver and one child or something like that in transportation. Hold on, sweetie. And so I think just kind of making ourselves aware of some of the community supports that are either absolutely great or maybe might, pose challenges for certain populations, and then see if any populations are kind of disproportionately affected by those things. Might help Hopkins and other hospitals really reach out in a more meaningful way and maybe implement some measures that would be really impactful and really helpful in kind of flattening that area of disparity. I think kind of the root causes, we have a lot of data about health disparities, but do we have a lot of data on what the root causes of those disparities might be?
Mm-hmm. Mm-hmm. So as a patient and family advisor, are you thinking that might be something that patient and family advisors might be able to lend a hand in asking those questions?
I would absolutely love to do something like that. Yeah, I think maybe having somebody, again, I know during COVID it might not be feasible to be person to person, but even via telemedicine at the end of somebody's stay, or if there's, a patient who hasn't returned for follow-up, maybe just inquiring as to why as well, instead of just a reminder, maybe say, hey, is there, I'm not sure how you'd go about doing that, to be honest, because I know that there are a lot of kind of legal and logistical factors. I do not work in healthcare, that I might not understand surrounding privacy and HIPAA and whatnot. But I think that I would love to be a part of something like that, with regard to just seeing kind of what people's barriers to healthcare are, and how as a hospital community we can try to curb those disparities as much as possible.
Great. Thanks, Rebecca. I appreciate you sharing your idea. And I would be curious if you have the opportunity to talk to the coordinator for your PFAC and share those ideas and see what you guys might be able to do together.
Awesome.
So I want to open it up to the questions that are on the screen right now and see if any of you have thoughts or things, experiences that you can share about that you're doing in your community about any of these items. But in particular, I'm interested in what's happening to support those who are affected by COVID and inviting their voices into ongoing conversations about healthcare improvement.
Mary, Lillian would like to, Lillian Hannon would like to share.
Oh,
something.
okay, great.
Lillian, you can unmute.
Hi, everyone. So this is in sort of in response to what Rebecca said, but also in response to some of these questions. We are currently going to start a case study on our pediatric ICU about the impact that COVID has had on our families and on the patients. Our patient population is mostly less than 5 years old. And so, you know, it affects the parents in tremendous ways. We have a lot of kids that have been here for, you know, more than a month. And so the parents can switch out every 24 hours, or it's just been one parent while the other is working or taking care of the kids. And it's been very difficult. And so, you know, we have just last week, I think on Friday, changed our visitation so that we can have 2 parents for the hospitalization. So, you know, that's good. The relief on some of our parents' faces was tremendous. And so as far as including the voices of those affected by COVID, even the kids that have not had respiratory difficulties, our heart surgery patients, they still are affected by the visitation practice, and the loneliness and the despair that we've seen in the parents is great. And so, like I said, we're going to start doing some case studies on 6 or 7 families, and we're in the process of getting permissions and going to consent them. And I'm really looking forward to see how it turns out. You know, some of the kids will be surgery patients, some of them will be a short stay, some a long stay, some that have been here since before visitation changed to now when it's changed again, that, you know, that have been here since February. And so I'm just really looking forward to doing it. And when we, you know, get our article written, I will be happy to share our results with the group. But, you know, from a personal level, talking to these families every day, the sadness and the loneliness has been great for these parents. And as far as preparing for a potential surge, we are in Houston, and so it's a big city. And from the beginning, our hospital has had a 4-phased approach to different stages of readiness. And I think right now we're in like phase 2. So we've definitely got some room to grow our critical care beds in the pediatric and in the adult areas of our hospital. So, you know, they have a plan, and we do have the weekly town halls to talk with the staff and let everybody know candidly what's going on. So I think that in my hospital, at least, we're ready. We certainly hope that there's not a surge, but we're ready.
Great. Thank you for sharing. And
Thank
thanks
you.
for being willing to share the case studies. I think case studies are a great way to illuminate issues that have emerged during this time and share them broadly so that others who may not have the capacity to set up case studies can really learn from those case studies from others. Adrian was talking about, is anyone opening up their town halls to community members? And if so, how? I know that some town halls we've talked about today have been for staff, but are others doing town halls for patients and families and the general community?
Our IBD, Family Advisory Council, did a town hall with their staff when COVID first started to help coach families. They opened it up to the whole community. It didn't have to be Packard patients. And to explain how to stay safe when coming to appointments and what the procedure would be, and to answer questions. And that got a really good response, and I think they're planning another one.
And did they do that? How did they do the invitation or make it widely known? Did they work with the...
That was the physicians, and they talked to all their colleagues. They opened it up to other places, and the FAC put it up on social media in their chat group. I guess there's organized Facebook groups for IBD. They announced it there. So they spread the word both from colleague to colleague and from the patients themselves.
Great. And it looks like Kristen talked about that Swedish hosted some Facebook Live events with a particular focus that was open to the community, which is a great idea. I think in some ways we're fortunate. It's not great to have a pandemic. However, it is fortunate that we live in a time where there are virtual opportunities to continue to connect with people. And Sue, do you want to talk a little bit about your town halls that you've been doing? Because it looks like there's a lot going on where you are.
Yeah, the Johns Hopkins, sorry, I was on mute. The Johns Hopkins Children's Center has done, I think, 7. We have 2 more this week. We're doing them by division: oncology, cardiology, endocrine, GI, adolescent medicine, and then our co-directors also hosted 2 just with general information about COVID and the Children's Center. And then all of them are being posted to the website, so any member of the public can view them.
So that if they miss it, they've got a recording, they can see what happened. That's great.
Yeah, I mean, I think we plan, depending on how they've gone better. The ones that have been better attended are really by the divisions, because when your physician reaches out to you and says, hey, we're doing this, I think people are more apt to tune in than the leadership of the hospital. So it's really that personal connection, I think, has gotten higher numbers. Also, they sent my chart messages to patients, posted it on social media, and those kinds of things. But I think as school ramps up in the fall, I think there might be another round of these, trying to just put people's fears aside as the fall comes into view.
Great, thanks for sharing. Terry, I know that you've made a couple chats. One has been about you're opening up a visitation today, and also some town halls. You want to comment a little bit more about the process that occurred to get you to a place where you're opening visitation?
Sure. Can you hear me okay?
I can.
So we've been having, for the past 3 weeks, I would say, 1 or 2 meetings a week to discuss about visitations and the concerns that any of the staff and leadership had about it. Also involved feedback to get their voice and their feedback. And we went back and forth as to whether we should restrict it to one support person only, rather than one person at a time. And we settled with having it be one person at a time for a couple of reasons. One, there could be a patient that has, say, 2 or 3 children, and to really limit it to just one of their kids is not really fair to the patient or the family. So we do have a tracking at the screening point of the hospital. The visitors are screened for their COVID questions, and then they all get the temperature, and then our security personnel will go in and mark if the room has a visitor. So we know at any point in time that there's a visitor in, but someone can visit and then go outside and let another family member in. We do have the time from 10 a.m. to 8 p.m. Certainly, we realize if there's someone that pushes to be a support person overnight, that is something that we would have to do per joint commission. Currently, it's for inpatient, EDs, and ambulatory surgery. We will see how this goes, and then we will look to open it up for outpatient services such as lab and radiology and physician offices. So it started today. So
great. Well, you have to keep us posted on how it goes and how you continue to involve your patient and family advisors and those who experience the relaxation of the restrictions from their
yes, and we do have a meeting tomorrow that we're pulling one of our COVID positive family members into. Now that our numbers are down and we have less, we had buddies and then a runner in critical care along with the nurses caring for the patients. And now that the critical care nurses don't have that extra support, the Zoom calls, if there's more than 2 a day, has been challenging for the staff to be able to do that. So we are having a meeting tomorrow with some CCU staff and bringing in a couple of family members of patients who had COVID to see if we can develop some kind of guidelines that will be meaningful for the patients and families and something that the staff can work with. So that'll be interesting.
Great. Well, keep us posted. There's been some great chat going on, and I'm looking up at the time and it says we have 3 minutes left, and this always happens. We have so much experience and passion and compassion among our participants on these calls, and I learn so much each time. So I want to thank you for everyone for sharing in chat as well as in in real time. But we do need to move on and kind of wrap things up. So I wanted to go to the next slide. For those of you, and I know some people are new names I haven't seen on these chats. So for those of you that have heard this before, please bear with me. But our next steps are that we record today's conversation and we keep a copy of the record and we share any relevant links that we have. And we encourage you to complete an evaluation that Marie is going to put in the chat right now so that we know what additional topics you'd like to be talking about, or if you've got suggested examples and tools that we can put into our PFCC Connect community. We want to continue this discussion online, and I hope that you connect with each other. So we do want to continue the conversations and connections and the networking because this learning is really powerful. Next slide. For those of you that aren't aware, we do have a special site on our website related to best practices related to COVID. Next slide. We are going to continue conversations. We've got an upcoming webinar on patient and family-centered care and pediatric partnerships that's going to be focused on the most vulnerable children. And I know some of you mentioned that you're in pediatric hospitals. So you can register for that, and we will put that link in the chat as well as include it in the follow-up email that you'll get with all the materials next week from Natasha. But that will be our next COVID activity for this month. Next slide. And if you have not participated on our website for the survey for tracking the impact of COVID-19 on PFCC, we encourage you to do so. This is a primarily national, but we're also including Canadians and others to fill it out. We're wanting to hear from hospitals, and since 77% of you were represented and are in that environment, we encourage you to complete the survey. And you can also click on and see the results. We try to update the results every 2 weeks. We're doing this in partnership with the University of California in San Francisco and with the University of Washington nurses. So this is an important thing for us to keep track of and understand. So we encourage you to complete the survey. Next slide. Those of you that might not be members of PFCC Connect, we encourage you to do that. But the most exciting slide that I want to share has to do with the fact that we had planned an international conference in Nashville in August, and obviously because of COVID, we can't do that safely. So we are going to bring Nashville to you and at a much reduced rate. And so we hope many of you will join us virtually to participate in our international conference. Talk about networking. We're going to do some pretty exciting and innovative networking with each other. And we have lots of posters and great presentations, and our focus is on quality, safety, and equity. So we encourage you to register for that if you'd like. And I think we are ready for our last slide, which is just our thank you slide, right? So we really appreciate you spending the time with us, sharing what you're learning, raising important questions, and we will continue to have these conversations. And the next will be in July. You'll see it advertised through PFCC Connect. But until then, be sure and give us your feedback about how we can improve and what you're interested in having conversations about. Feel free to contact Marie or myself, and have a great rest of your day. Thank you so much.